Today we're going to talk about back pain, and did you realize that 80% of people actually feel back pain at some point in their life? So now we're going to talk about what back pain is, what causes it, and different ways to help prevent it. So, common causes of back pain. It can be a muscle strain. Say you're working out. Say you've been working in the garden. Say that you've been shoveling snow here in Idaho. We see a lot of people during the winter, and that can cause. There's a variety of reasons. So obviously, if you strain a muscle, that means that the muscles that should be sliding together, moving, the fiber should be moving like this. Then it's kinked up and it's not able to move like that. Now, one of the ways that you can deal with that is stretching. And there's a variety of different stretches you can do. Stretches for the low back, stretches for the mid back, stretches for the neck. But we also here in the office, we do trigger point injections. And so what that means is you've got that bound up muscle, and our nurse practitioner injects lidocaine down into that, and that helps to relax the muscle so that it can move better. And we also do active release technique, which is a soft tissue technique where we can move the muscle from a shortened to a lengthened position. And so that means, like in the arm, this is shortened, this is lengthened. So we contact right here on the muscle, and then as it lengthens, the muscle stretches under our finger or our thumb, and you can actually feel adhesions in there, which is basically kind of like glue. And it won't let the fibers slide the way they're supposed to. Well, with that thumb or finger contact, as it slides down the muscle, as it goes from shortened to lengthened, we can feel those adhesions and we can help break them up, and that allows the muscle to move more smoothly. Now, we can also have arthritis in a joint in the back, and that can cause pain. So what we do as chiropractors is we help to restore that normal motion in the joint, and that can relieve some of that inflammation, because all arthritis means, the definition is arth is joint and itis is inflammation. So if you always wondered why arthritis sounds so scary, when you break it down into what it means, it's just joint inflammation. Now, we also have subluxations, and what a subluxation is, I'll take my trusty spine here. So subluxation, the nerves come out here and they come out of these little holes right here. And so when the two vertebrae come together, let me see if I can see it better down here. So the two bones come together and there's a disc between each one. Now the nerves come out of those holes. And if there's a misalignment, so say it's bent to the right, or it's shifted backward, or it's rotated, that can kind of pinch that nerve because the hole between the two bones gets smaller. And so we call that a subluxation. And so what chiropractors do, say we're looking at it like so, and what we do is we gradually realign the spine through a series of adjustments, and that lines these up, opens up the holes, takes the pressure off the nerves, and then you don't have the back pain. Now, we can't move the vertebra or the bones all at one time and fix everything in one shot, because the bones are used to being in one position, and if you just try to shift them way over, you're going to make the situation worse. But you'll notice if we just move it a little bit and take just a tiny amount of pressure off that nerve, that you'll notice a really big difference in how you feel. But because it's used to having that misalignment or that structural damage that allows those pinched nerves to exist in the first place, then it's just going to keep coming back again and again. So through a series of adjustments, we move it just a little bit, just a couple millimeters, and then it's going to move back about half that because it's used to be in that wrong, incorrect position. So over a series of adjustments, it keeps improving that alignment until you get to a point where there's no pressure on the nerves at all. The alignment is corrected as much as possible, and the disc and the hole have opened up, and then you don't have to worry about the subluxations coming back again. And it's kind of like we make that the first correction is getting the bone barely off the nerve. But then once we get it off the nerve, we have to strengthen that correction to make sure that that structural damage is corrected, and that way there's not going to be pressure on the nerve. So that's kind of like wearing braces on your teeth. Okay, now people wear braces for years, but in our office and a lot of chiropractic offices, you can correct that within 4 to 6 months. So it's not years like it is for your teeth. And what's more important, your teeth or your vertebrae? But because we're all vain and want to look nice, which isn't necessarily a bad thing, we want to make sure that our teeth are straight and don't realize that we're neglecting our back, which is going to cause a lot of issues down the road. So then once we make that correction, then we strengthen it, like I said, and that's kind of like wearing a retainer after wearing your braces. So what happens if you don't wear your retainer? For all the braces people out there, well, that's right, it goes back out of alignment. So we have to strengthen that adjustment, and then once that happens, we also have to make sure as we go through life that those subluxations don't come back. So that's kind of like brushing and flossing your teeth. It's not because your teeth hurt, that's not why you do it. You do it because as long as you're eating food, you want to keep those cavities from coming in the first place. Same thing with the spine. So you can get moved into what we call a maintenance phase, which is a proactive phase, where you come in once a month, once every 3 weeks. It depends on the case. And that helps to maintain that proper alignment so that you don't get the pain and symptoms anymore. So the subluxation is really important. Treating muscle strains is important. And people often ask, well, what can I do if I'm on vacation and I can't get adjusted? What can I do? Well, there's certain exercises you can do at home that can help improve and maintain the alignment that you've already established before you leave for your vacation. So one of the exercises for neck pain is you lay on the back of the bed, on your back, on the edge of the bed, let your head fall back, and the edge of the bed is right up here if you have a reverse curve, which a lot of us do because of all this technology nowadays, looking down at a phone or looking at a computer while you're working. And so the edge of the bed forces that curve in there, and you just lay your head back, make sure you're breathing, of course, and the breathing helps relax the muscles, and then that's going to help restore the back and make sure that those misalignments don't come back anymore, at least while you're on vacation. So that's going to help you maintain the adjustment and the alignment. And the low back, some interesting things you can do. Oh, one more thing about the neck is you can grab the collar of your shirt and just kind of rest your arms down. You're not pulling, but you just rest your arms, and instead of the edge of the bed, it's your shirt collar that's acting like a pivot point, and then you look up and then straight ahead. So it's a repetitive motion like this, and when you look straight ahead, you can relax the pressure, rest your arms down, look up, straight ahead. Recommend starting with 25 and working your way up to 100 reps of that. And once again, that helps to maintain the adjustment and the alignment that you've gotten at the chiropractic office. Now, muscle strains can be an issue, especially in the low back. A lot of times, if anybody watched Happy Days back in the day, sorry, I'm dating myself, but Mr. Cunningham, Richie's dad, would bend down and he'd come walking out and he would hurt his back, and he's like, oh, I threw my back out again, threw my back out. And what that means is you have pressure on that nerve, but it's not quite enough to feel it, and then I hear this all the time. I bent down to pick up a pencil, or nothing big, or sometimes it can be I was picking up my grandchild and my back went out and I had shooting pain and things like that. So all that means is the tiny bit of pressure you had on that nerve, when you made that movement, it pushed into the nerve more, and just the weight of a dime pressure on a nerve can affect its conductivity or connection to the brain by up to 80%. So we don't want that. So that's why you can do certain stretches that help relax the muscles and help to prevent those misalignments from coming in the first place. Now you can do core strengthening exercises. You can do bending over, if you've heard of a Swiss ball, those big exercise balls, you don't bend forward over the ball because that's going to push the disc back into the nerve more. you go back over, it's called extension, so you're bending back this way over the ball, and that helps to pull the disc away from the nerve. So that's some tips, some brief explanation of some exercises you can do. If you do have symptoms like this, come by and see us here if you're in the Boise area, and if you're not, then find a chiropractor in your area. Sometimes different chiropractors use different techniques, and some people are comfortable with them, some people aren't. They are all effective for the most part, but just seek out a chiropractor, and if you find one you don't like, go to another one. It's kind of like a dentist. I went to a dentist once that was putting a screw. I chipped my tooth, and he was trying to put a screw in there to help repair and put that little extra part in my tooth to make sure I didn't look like I had a big chipped tooth. And he didn't even give me any anesthesia or any deadening injection or medication or gas, I guess, at the dentist. And so he literally drilled that little screw into the back of my tooth, and I about jumped out of the chair because it hurt so bad. That screw touched the nerve in my tooth. It was awful. So do you think I went back to him again? No. So I found another dentist that was much more caring, it seemed to me, and wasn't going to start drilling hardware into my teeth without giving me some sort of deadening agent so I couldn't feel it. So don't get discouraged if you go to a chiropractor that you don't like, you have a bad experience. That just might be you don't connect with that individual chiropractor, and he doesn't understand what you need, or that his technique might not work. And just keep looking until you find a good one that you connect with, and that he understands you, you understand him, and it just is going to be better all the way around. So those are some tips on back pain causes, what you can do to help fix them, even at home, and consulting a professional to help realign them and make it go away. All right.